The Alberta Medical Association says it's broken down the numbers, and the cost of deterring COVID-19 vaccination will likely be in the tens of millions. It says if even 5% of Albertans decide not to get vaccinated, the resulting hospitalizations are projected to cost more than $65 million. CTV's Nicole Weisberg reports.
You have reached Primary Care Alberta.
Getting through to book a COVID-19 vaccination appointment has been a challenge for some Albertans. CTV News called 811 intermittently throughout the day today and was met by this.
We are currently experiencing a higher than expected call volume, and all staff members are busy. Please try calling back later or book online.
Medical professionals say barriers like this and the fact this year many have to pay out of pocket to get the shot will no doubt lead to less uptake.
Paying your rent, eating versus, getting a vaccine. I think people are going to choose, the things that they see right in front of them on a day-to-day basis.
The Alberta Medical Association says people foregoing vaccination comes at a significant cost to taxpayers for added hospital bills and the impacts of complications on the healthcare system.
We know that Albertans who are unvaccinated in previous years for COVID were 10 times more likely to be hospitalized. 20 times more likely to be hospitalized compared to people who had had a booster.
The AMA estimates if even 5% of Albertans, or about 250,000 people, aren't vaccinated, it would mean more than $65 million in spending on hospitalizations alone. At 10%, the costs rise to $131 million, and at 20%, $262 million. The numbers are based on a 15% infection risk, a plausible scenario, the AMA says, based on wastewater data from August 2024.
So if your goal is what the government is saying it is, to reduce wastage and support responsible spending, then what you do is you buy a vaccine for every Albertan who would qualify. And then you connect it with a robust communication plan.
The province says its approach is in line with guidance from the National Advisory Committee on Immunization, which suggests COVID-19 vaccination should be considered optional for healthy non-senior adults. And the committee cites analysis showing universal COVID vaccination would not be cost-effective at this point. Nicole Weisberg, CTV News, Edmonton.